Sure. Okay. And then I just need to get that to be full screen. Okay. How does that look? Whoops. How does that look to everyone? All right, perfect. So as Maureen mentioned, my name is Kim. I'm a community outreach specialist at the Brain Injury Alliance. We are statewide, so our main headquarters is North Brunswick, but we do cover every county. I personally cover a lot of like the central shore areas of the state, but we have staff all over the place. So I'll go more into a little bit about what we do later on in the presentation, but I will be discussing, like Maureen mentioned, that intersection between mental health, suicide, and brain injury in youth. So these issues might at face value seem disconnected and like they might not overlap, but we do see that there's disproportionately high rates of mental health concerns and suicidal ideation in the brain injury population. So that would also expand out to youth with concussion, for example. So first I'll provide a little bit of an overview of brain injury so that we get a better handle on what exactly is encompassed in that term and what is not included in that term. Then we'll talk more about that specific relationship between mental health, suicide, and brain injury. Talk about some risk factors from related issues that might be out there, barriers to treatment, and then reviewing some considerations for prevention strategies. So brain injury has two categories underneath it. There's acquired brain injury and traumatic brain injury. Traumatic brain injury would be the concussion, motor vehicle crashes. A lot of times interpersonal violence can lead to traumatic brain injury, domestic violence. Falls. So that's more of an external hit to the head is a traumatic brain injury. And then there's acquired brain injury. So that's more of an internal event that can be from stroke, aneurysms, infections like meningitis or encephalitis, toxic exposures like lead exposure, carbon monoxide, and anytime the brain doesn't get enough oxygen. So any situation where there's an anoxia present. So that might be a near drowning experience, choking, if someone has suffocation, maybe they're a victim of domestic violence and they've been suffocated. Anything like that can lead to brain injury. And so just some quick statistics for brain injury in youth. We see that over 17,000 related TBI hospitalizations occur annually among those ages 0 to 17. There's about 1,800 TBI related deaths annually in this age group. About 15% of high school students, roughly about 15% yearly, report having had a concussion in the past year. Especially, of course, we see among athletes, the rate is disproportionately high. And about 7 out of 10 emergency department visits due to concussions are children 17 and under. And then 45% of those are due to contact sports. So sports that we see that have the highest rates would be like football, combat sports like wrestling, boxing, and then soccer as well has high rates. So leading causes, like I mentioned, sports, right? Teen driving. So we know that teens are always a risk factor on the roads, right? Oftentimes they're still getting used to driving, they don't have a handle on it yet. They might be driving recklessly, right? So car crashes are the second leading cause of TBI hospitalization and the first leading cause of TBI death among youth. Bicycle crashes, playground accidents, that's more of the younger children, so that might be like the 0 to 6 age group, or 2 to 6 age group, sorry. And then pedestrian crashes. So we see that in New Jersey, we have the third highest rate of pedestrian crashes in the nation, just because of how densely populated we are. And so there's 3 different severities that are used to classify brain injury. There's mild, moderate, and severe. These are classified due to the severity at the time of the injury, as well as the period of time the person lost consciousness for. So as you can see, mild might be loss of consciousness for 0 to 30 minutes. Most mild traumatic brain injuries don't involve loss of consciousness, and mild TBIs won't show up on imaging. So if someone goes to the hospital, gets a CAT scan or MRI, it won't show up on those tests because it's more of a functional versus a structural injury. Also, I want to mention concussion is a mild TBI. So those terms, mild traumatic brain injury, concussion, they mean the exact same thing. Moderate brain injury might be more of a loss of consciousness, longer time frame. Usually moderate and severe brain injury do show up on imaging tests, and there might be a higher degree of amnesia, confusion, some long-lasting cognitive side effects. So concussion is a mild traumatic brain injury. Like I mentioned, it can occur to a hit to the head or to the upper body or an indirect blow elsewhere on the body. So if someone's hit really hard on the back or the chest, it can transmit an impulsive force up to the head that causes the brain to move around inside of the skull. So like I mentioned, it's more chemical changes versus physical changes. And so due to the location of the bony ridges in our skull, the frontal and temporal lobes are most at risk. These are responsible for judgment, reasoning, behavior control, motivation, emotional regulation. And so when it comes to treatment for mental and behavioral health, these symptoms can really act as a barrier, right? So they really have significant implications when it comes to treatment. And so since the brain is in control of everything we do, it can affect us physically, cognitively, and even emotional and behaviorally. And oftentimes with mild TBI, one of the most significant symptoms we see is emotional and behavioral in nature. Physically, many of you might be familiar with these symptoms, but headache, neck pain, right, dizziness, confusion, nausea, vomiting, like noise sensitivity, right? So those are the more well-known symptoms from concussion. And then cognitively, someone might be foggy, might have difficulty with memory, slow processing speed. Emotionally, we see that many times anyone of any age, but especially youth with concussion, have higher rates of anxiety, depression. They might be really irritable, that decreased frustration tolerance where they get really overloaded very easily. And also anger. So we see that those with concussion or brain injury have they're much quicker to anger in some cases. So all of these can be symptoms. Longer term, if we look at that emotional and behavioral category, it might result in impulsivity, which can result in getting in trouble more often, not being able to control themselves in a controlled environment like a classroom per se. They may be acting out. Depression, anxiety, like I mentioned, have higher rates, frustration, and their judgment might be impaired. So that may lead to making poor decisions as well. I'm going to skip this video in the interest of time. But all of these changes can have a significant impact on so many different areas of functioning. So a youth with brain injury might have poor grades due to cognitive difficulties, right? Like comprehension, attention, motivation, initiation. They may experience social isolation, especially if they have trouble maintaining relationships, if they struggle maybe picking up on social cues, or if they can't attend social gatherings due to lack of energy or lack of motivation. They may also experience really shaken identity. So if, for example, they were a soccer star and straight A student, and now their grades are suffering and they're not able to play soccer anymore, these core parts of their sense of self can really be compromised. And so that can have a really profound impact. They may also experience changes in physical activity. So maybe they can't stay as physically active as before in the same way they used to, can't participate in activities like they used to. And like I mentioned, they may also exhibit an increase in some risk-taking behaviors due to symptoms of brain injury, like that impulsivity, disinhibition, symptoms like that. And so what we always say is every person is different prior to an injury. Every injury itself is different biochemically, and every person with brain injury adjusts differently to all the changes that occur. And so what we say is if you meet one person with a brain injury, you meet one person with a brain injury, right? They're all so different. And next, we'll talk more specifically about the intersection of mental health and brain injury. So are there any symptoms or are there any questions as of now up to this point? Anything at all I can clarify? Okay. So this is just a quick introduction video that exhibits this connection between suicide and brain injury and how brain injury might eventually lead to suicidal ideation through complications, mental health symptoms. So just a quick introduction. And let me know that you can hear my screen. If you don't mind just giving me a thumbs up if you can hear it.
Gone was my man. I remember the first time he put on skates. He spent more time on his face than on his feet, and I didn't think he'd like it. He loved it. He loved it. Couldn't get enough of it. He couldn't get enough of it. As a young boy, you know, he couldn't get up to go to school, but to get to hockey practice, he'd be waking me up every morning, you know, and games, everything. He just loved playing hockey. There was no outward change in him. And I'd say, you know, my man, you good? You good? And he's like, Dad, I'm better than you. Stop asking me. Stop asking me. So then I kind of stopped asking him, to be honest with you. We really just thought this concussion was just going to be something that he'll get through, you know, under a phenomenal doctor's care, and we would just get through it. We had no idea he was fighting depression. He just always wanted to be the best, you know, like his coaches will tell you. And, you know, he would come home from a practice or a game, and if he didn't feel like he was skating the fastest or he got beat on something, he would just go down to this local park we have, and he would just work on his footwork. He was a gamer. He just wanted to, you know, perform his best. And I think he thought he could beat this, you know, depression. With my son, I think it was most important for me to let him know it's okay. It's all right, bud. You got depression. I know you do. It's because your chemicals in your brain aren't, you know, working right. They have to understand that. It's not because you're weak. It's not because you're any of those things.
So that video is difficult to watch, but it just provides a nice introduction into what that intersection might look like in a real world scenario. And so what we know from the research is that there is a connection between concussion, suicide, and mental health. Numerous studies have examined the risk of mental health and suicidality in youth with concussions, and time again, it has been proven that youth with concussion are at higher risk for mental health and suicidality. So I just want to highlight a little bit of the research that's been done and kind of what they've found there. So youth athletes are one of the most at-risk populations when we talk about concussion. Like I mentioned, they're sustaining concussions at high rates. They're being exposed to potentially, dangerous situations through their sport. And so we might not always think about it this way, but new drivers are also at most risk of concussions. Car crashes are one of the leading causes of brain injury among youth. New drivers are often less confident on the road, right? They might still be learning, prone to distractions, might not be wearing seatbelts or taking, protective steps, might be driving under the influence. And so all these factors contribute to the high number of teen crashes and therefore the high number of brain injuries that are sustained this way. We do have a lot of research out there that shows a connection between concussion and domestic violence among adults as well. Not many studies have been done among youth specifically, but we can recognize that any kind of violence puts youth at risk of sustaining a brain injury. So one study done in Canada did explore that connection between teen dating violence and concussion. They found that there was a significant association between these things, especially with non-sports related concussions. So more research does need to be done to understand this connection with specifically teen dating violence and concussion, but we know that there seems to be a link there. And then other populations that have higher rates of brain injury might include individuals who are insecurely housed. We see higher rates there, those who have justice system involvement, and also individuals who have a high number of adverse childhood experiences or ACEs. And so we'll look at a couple of studies just to get a better handle on what the data is saying. But this first study used data from the 2017 Youth Risk Behavior Survey that represented nearly 15,000 students across the United States. And basically it analyzed the connection between suicide and concussion among youth. They did find that having a sports or physical activity related concussion was significantly associated with seriously considered attempting suicide, having made a suicide plan, and having attempted suicide even after controlling for physical activity, having played on a sports team, controlling for academic grades, controlling for hours of sleep. So, however, when they controlled for persistent feelings of sadness or hopelessness, this connection was no longer statistically significant. So basically what this is saying is that depression linked to concussion is the factor in eventual suicidality, right? So depression is kind of that mediating factor between the two. The second study looked at the connection between suicidality and having multiple concussions. So they also used data from the Youth Risk Behavioral Survey. They found that, like other studies, youth with concussion were at a greater risk of suicidality. However, they did go that one step further and found that, especially in males, the odds of reporting suicidality increased with the number of concussions. So the more concussions they had, the greater the odds were that they reported suicidality. This might be an indication, again, that there's a connection with how many concussions someone has sustained and how that multiple concussions may compound over time in terms of the symptoms. And so research also suggests that this relationship may be due to the fact that concussion can contribute to other risk factors for suicide, right? So depression can contribute to risk for depression. It might contribute to substance use. So there's a lot of research that's done that highlights the connection between concussion and substance use, which we'll look more about that in a few minutes. But we do see that youth with concussion are more likely to engage in substance use. In general, one of the symptoms of concussion is poor judgment and risk-taking behavior. So they may start engaging in this risky behavior that they maybe have not engaged in before the concussion. And this behavior may lead to these risk factors as well. Concussion can contribute to low grades, poor academic performance, insufficient sleep. So often sleep may be affected. Social isolation may also result. So like I mentioned before, youth with concussion may struggle to pick up on social cues, maintain relationships. Maybe they can't participate in social activities the same way anymore. And there may be a strain on family dynamics as well. And then lastly, due to impulsivity, poor judgment, decreased frustration tolerance, I mentioned this before, but youth with concussion may begin to act out, misbehave, getting in trouble at home or at school, whereas before the concussion, they may not have exhibited that behavior. And so we'll take a further look at some of the other risk factors, beginning with mental health. So there is a significant amount of research out there that has made this connection between concussion and mental health symptoms and diagnoses. So I'm just going to highlight two quick studies here. The first looked at over 400,000 youth across the nation that were ages 5 to 18 years old, and found that youth with concussion had a 40% greater risk of mental health issues. Also, higher risk of psychiatric hospitalization and self-harm than youth who had other types of orthopedic injuries. So there's something about having a concussion versus another type of injury that contributes to these mental health concerns. Concussion was found to exacerbate pre-existing mental health issues as well, and it was found to contribute to new mental health issues occurring. In the same vein, a second study found that pre-injury mental health difficulties were a strong predictor of post-concussion mental health outcomes. So just repeating this, finding that if a youth had pre-existing mental health conditions, that may be exacerbated by concussion. And so we're seeing this connection, but why? What does it come down to, right? What's actually causing this? So there are physiological changes that happen after a brain injury that might contribute to the development of mental health disorder. So that physical damage to the brain can disrupt communication between the cells, and that the frontal lobes and temporal lobes are most at risk due to the location. So they're most responsible for behavior, emotional regulation. Also, so many life changes occur, right? So changes in sports and activities, change in health status, in academics and grades, relationships might change, roles may change. Also, hopes and plans for the future may change. So for example, if a high school athlete is planning on going on to be pro, right? And they're relying on scholarships at the college level, but then they're not able to play sports anymore and their grades suffer, this may affect that. Oh, sorry, I just need to take a drink. Okay. And then trauma from the event that caused the brain injury. So if the brain injury is sustained through motor vehicle violence or through domestic violence, for example, there might be trauma from the event that caused it itself. And so there has been research done to connect history of concussion in youth athletes with substance use. There's this one study that was done in 2021 that used data from the CDC Youth Risk Behavior Survey that basically found that there was a greater prevalence of opioid misuse among those who had sustained at least one concussion that year. And also that the prevalence increased as the number of concussions increased. So overall, the study found that there was 1.5 times greater risk of opioid misuse among youth who have had concussions recently. So just basically in summary, we see that those with concussion are at higher risk of substance use. But it's not just opioids, right? So another study looked at the connection between concussions and substance use more in general. They used data from Monitor in the Future national survey, and they found that that youth with concussion had a 2 times greater risk of all kinds of substance use. An interesting thing to see about this is that they also looked at sensation seeking. So they thought maybe an adolescent who had a high propensity towards sensation seeking might be more likely to play sports or be in a situation where they sustain a concussion, right? But is also more likely to engage in risky behavior. So is sensation seeking this connection? And they found that, in fact, adolescents with a low propensity towards sensation seeking who had sustained a concussion actually had higher rates of engaging in substance use. So that tells us that maybe it's worth paying attention to those who typically, are least prone to attention seeking or sensation seeking, rather. In summary, those with multiple concussions had even higher odds of a cigarette use, marijuana use, binge drinking, substance use in general. So there's a few reasons why this might be. So it's possible that there's other mental health conditions at play, right? So students who have sustained a concussion or TBI can experience emotional and psychological symptoms like depression, anxiety, and we know that these diagnoses are associated with substance use. And also, as we've noted, brain injuries can cause significant changes to a person's life, right? So they may look to substances to cope with all these changes that are occurring. Also, those with a brain injury might have easy access to prescription medications. So many people who visit the hospital after a brain injury are discharged with a prescription for opioids, for example. There have been studies that have shown that around 70 to 80% of those who are hospitalized with brain injury are discharged with a prescription for opioids. So there's just this greater availability there, unfortunately. And then they might also have difficulty managing their dose, right, due to the brain injury, due to the memory symptoms. And so if they take a dose and they forget they took it, they take another one, then that can easily lead to an overdose if they're taking multiple doses without remembering that they took them. And so also, those with a brain injury might be socially isolated, like we talked about. They might not have friends and family around. They might also have excess free time if they're not able to participate in activities they used to enjoy. So they may turn to substances to kind of fill that void. And then lastly, like we talked about, increased risky behaviors, right? So they might have limited judgment and reasoning skills, might be more likely to engage in impulsive or risky behavior. So I just want to briefly highlight some of the treatment barriers due to concussion that can present themselves in a mental health treatment setting. So they might have issues regulating their behavior, so their intention might not always align with their behavior. Memory difficulties can really be a barrier if they're not remembering important pieces of information, remembering, homework that they have, strategies that they need to practice. Their attention and focus in sessions may suffer, so they might need redirection frequently. Problems with initiation, so just coming up with the goals and implementing them, taking the appropriate steps, taking that first step to kind of start on the road to treatment. Communication barriers, so they might not quite understand what you're trying to say to them. They might not be able to fully put into words what they're trying to explain. And then lastly, sensitivity to cognitive load. So they're more sensitive to feeling overwhelmed. If there's a lot going on, if there's a lot cognitively to take in, someone with a brain injury might become really overwhelmed, not be kind of shut down, right? So that's another treatment barrier. And so here's some considerations to take into account. So a lot of this discussion has been around concussion because that's probably what you'll be seeing most in that youth age group. Concussions are usually temporary. Usually they resolve in a few weeks, but there's this thing called post-concussion syndrome. Many of you have probably heard of it. but it's basically what long COVID is to COVID, right? So most people with COVID got totally better within 2 to 3 weeks. Same with concussion, but then some people had symptoms for months. And so basically it's the same idea. Someone might have symptoms for weeks, months. Sometimes with post-concussion syndrome, it could be years, right? That they're not getting better and they're just wondering, why are these effects lingering? I should be better by now. And oftentimes those lingering effects are mental health related or behavioral in nature. Also, symptoms might not appear right away. So symptoms might take days or weeks to come on. I've even heard about symptoms taking months to come on. And so it's not always apparent right away in what ways the concussion might affect the person. And then also I want to note that post-concussion syndrome or moderate to severe brain injury symptoms might overlap with mental health symptoms. So oftentimes, like if you see a list of behavioral and emotional symptoms that might result from brain injury, it's basically the same as a lot of mental health diagnostics, right? Symptoms. So the key to telling the difference is basically before and after, right? Is what we usually say. Is there has to be, you look at the change before and after. Were they struggling with mental health concerns before? Are they now after? Has it changed? Has it gotten worse? Are they new concerns? And then also, in order for there to be a diagnosis of brain injury, there has to be a precipitating event. So whether that be a sports-related concussion where they fall, or a ball hits them on the head, or domestic violence, there has to be something, or stroke or aneurysm, anything that might cause brain injury. There just has to be a precipitating factor there. But oftentimes, it is treated the same in a mental health treatment setting, and so regardless of what it's caused from, the symptoms are kind of addressed a similar way. One of the key differences is that you might need to take into account more strategies, cognitive strategies, so memory strategies or redirection, maybe writing things down. So some of these kind of accommodations to make sure that they best succeed in treatment. So that's another consideration. Also, sometimes youth with concussion or brain injury will need to see a specialist like neuropsychologist or neuropsychiatrist, depending on the severity of their symptoms. Something else I want to highlight is that non-fatal self-harm can cause brain injury. So we have seen this in the past. So hangings, being one of the leading causes of suicide in youth in New Jersey, can leave someone with an anoxic brain injury due to the lack of oxygen. We have worked with individuals over the years who have sustained brain injuries from non-fatal gunshot wounds to the head, non-fatal overdoses, either on medications or narcotics, which also cause an anoxic brain injury. So we have seen this in our work. So statistically, between the years of 2016 and 2017, approximately 350 youth between those ages of 10 and 24 were hospitalized annually for a TBI due to intentional self-harm. And so this is another concern that I wanted to highlight. And so now, knowing all of this information, I want to discuss some information to inform prevention practices. So discussing some tangible prevention strategies for youth with concussions. The first thing that we can do is educate, right? Raise awareness of the increased risk that youth with concussion have for suicide and mental health issues. So we often connect concussion with youth athletes, which makes sense, right? Because they're generally at higher risk. They're often the ones sustaining the concussions. So educating parents, coaches, right, about the risk, athletic trainers, any athletic staff. Also keeping in mind that youth athletes are not the only ones at risk for concussion, right? New drivers, like we said, were at risk. Youth in violent situations, like dating violence situations, are also at higher risk. And so just keeping that in mind as well. And then providing gatekeeper training to those who are interacting with youth who are at risk. So I know Maureen had mentioned that we're trying to get gatekeeper training for our staff as well, so that we're informed, since we're seeing this in our practice. But educating anyone who might be involved, coaches, like I said, trainers, teammates, youth athletes, parents, anyone who might be involved with this population that's more at risk. We can also advocate for mental health assessments, right, to be done for youth who sustain concussions. So depending on the medical help that the youth with concussion seeks after sustaining it, it might not include a thorough mental health assessment. And so it's important to ensure that that assessment is done, especially if sometimes if they go to a primary care provider who might not be as informed about concussion, they don't always do this assessment. And then also imperative that we identify and monitor high-risk youth who go on to sustain a concussion. So if someone has a pre-existing mental health challenge, goes on to sustain a concussion, we know that they're now even at higher risk, right? We want to make sure no one slips through the cracks there. And then monitoring youth with concussions closely during that acute period, right? And then if they have post-concussion syndrome. So just right after the concussion occurs, doing that assessment, monitoring, encouraging them to report to an adult if they do experience any changes that come up later, since symptoms might not appear right away. So, educating teachers, again, coaches, anyone who might be coming into contact with them. Also, research suggests that physical activity is actually a protective factor among youth against suicide. After concussion too, it can actually help with concussion recovery. So I know the old guidance was basically to cocoon after a concussion, like lay in a dark room, don't do anything at all, just lay in the dark. That is not the guidance anymore. So they basically say now that 24 to 48 hours after the concussion, it's important to do some light aerobic activity. So walking, getting outside, nothing too strenuous, but light physical activity does help with recovery. And as we know, it's a protective factor against suicide and mental health concerns as well. So we want to make sure that with that physical activity, they're not putting themselves at higher risk of another concussion, right? So we want to make sure they're not doing contact sports or doing any sort of risky activity, but just walking around the block, something like that, safe. Generally, but we did talk about pedestrian injury, so that's a whole nother field of education over there. And then ensuring youth remain integrated into their social network. So we see that that's a huge risk factor for these mental health concerns coming on after concussion is the social isolation. And so ensuring that the coaches are keeping them involved in some way, even if it's just sitting on the sideline and helping with, paperwork, whatever it might be, or ensuring that the students' circle of friends are keeping them involved, still kind of inviting them to things or spending time with them at school. And then time is of the essence, right? So with concussion, we want to make sure that it's being addressed swiftly, that the assessments, including the mental health assessment, is being done swiftly, but also, again, monitoring down the line in case symptoms appear later on. And then lastly, referring if needed. So I talked about neuropsychiatrists, neuropsychologists. Sometimes those kinds of specialists are needed in cases that involve both brain injury and mental health concerns. So just keeping that in mind too. So I do have a few resources here. If you're interested in more research, that Ohio Valley Center for Brain Injury Prevention and Rehabilitation is a great place to go. Model Systems Knowledge Translation Center, which is on the bottom right, is also a great place to go for research. Otherwise, Brain Injury Association of America has great info sheets. Brainline, same thing. And we do have these one-pagers that I can send out: mental health considerations after brain injuries, substance use. And then I can just take a couple minutes to talk briefly about what we offer as well. And then let me look in the chat. I don't see any questions yet, but if anyone has questions, feel free to put them in. So we, like I mentioned, are a statewide nonprofit. All of our support services are free of charge. We're funded by the state. And so we provide case management for all ages. We have one specific to kids called Cares for Kids, that's up to age 18. We are involved with the TBI fund. And so this is a state fund of last resort for anyone seeking financial assistance for brain injury services. Helpline, so that functions Monday to Friday, 9 to 5. If there's any questions about brain injury, questions about resources that are out there, say if you need to find a neuropsychologist to refer to in the Middlesex County area, you can call and we'll help you locate different services like that. Support groups, right? So we have support groups, both virtual and in person throughout the whole state. Some are for caregivers, some are for survivors. We do have a young adult support group starting up. That's good for that kind of teenage, young 20s age group. And And then we have a camp every year for adults with brain injury. This coming summer, we're also having one for families with kids with brain injury. And so it's more of a family camp. It's going to be 5 nights, sleep away, and the whole family's welcome to come, whether it be the parent with brain injury, the child with brain injury, anyone who's affected in that way. We'll do webinars once a month. So we just did one yesterday about disorders of consciousness. We have another one coming up in, I believe, January, February about mental health and brain injury. We have one about neurodivergence and brain injury coming up. We also do regional trainings that are free each year for health and human service professionals. That is taking place in March, on March 6th and March 12th this year. They're free full-day trainings. We provide breakfast and lunch, and it's all about brain injury care. We do a variety of workshops, so on things like domestic violence and brain injury, substance use, mental health, about all those interconnected topics. Have a professional seminar every year in May. And then we also have a family fest. So for families impacted by brain injury, this is just a fun day to come and do fun activities and workshops. It usually, well, the last couple of years it took place at the Turtleback Zoo, and that's usually in June. And then just a couple more things. We have a program in the high schools called You Got Brains Champion Schools, where students receive a stipend to create a transportation safety campaign. And then they create the campaign. It ends with this big showcase at Six Flags where they show off their projects and go into the park to enjoy the rides. And they can win $10,000 to go back to their school as a result of that. We have a similar program for colleges as well. Like I said, we talk a lot about transportation safety, so we have a whole web page based on that. Do some legislative advocacy at the state level. And if you want to learn more about us, we have all different social media channels. And that's all I have for today. So are there any questions at all? Anything that I can clarify?
It was fantastic. Thank you. I think this was really very informative. It was hard for me to watch. I lost my 16-year-old to suicide. He was an athlete and no doubt had concussions. And there's been a lot of changes, and the one that was interesting was the whole 24 to 48 hours after concussion to go back to light physical activity. That is like a really big change from, 15 years ago. How about, their ability like to get back into schoolwork? Because that was the thing too, is they had to rest, physically and also not kind of tax their brain. Has that changed?
Right. Yeah. So the guidance for that changed 2 years ago. There's every about 4 or 5 years, there's an international consensus statement published on concussion in sport that kind of goes over the most recent research that's been done and then updates the guidelines. So that happened in 2022, and they basically updated it to say that return to school has to be completed before return to play. So depending on the individual, that return to school process might be only a couple of weeks or a week or 3 days even. But for some people, it might take longer. Also, they might need accommodations put into place to help them succeed in the school environment. But until that's completely done and over with, so until they're completely reintegrated into the school setting again, they can't start that return to sport process. And so that also is gradual, individualized, and generally starts with just non-contact training drills or, higher intensity exercise alone.
And are you finding buy-in from coaches? Because even again, going back 15 years, I can hear my son's coach saying, I don't believe in concussions. They make so much of this. So I'm wondering, are we seeing a shift that the coaches are open to these trainings and having more of an understanding?
Yeah, luckily we are seeing a bit of a shift. Of course, not in everyone. We still sometimes hear that rhetoric of, downplaying concussions, but we are seeing a bit of a shift, especially as the trainings have been encouraged more. There has been increased accountability too. So a lot of these trainings are required now, whereas that wasn't necessarily the case in the past. So there's just been more accountability, more education out there, more requirements for the education. And so I think that has helped. So it is getting better. Of course, we have more work to do, but at least there's been some steps forward. Yeah. And sorry to hear about your loss.
Thank you.
course.
Julie, I think you're up next.
Yes, I had to unmute myself. This was a great presentation and I really appreciate it. And I thought this is more of a sharing for awareness sake. Our son had 2 liver transplants, and because of the trauma to the liver, there's excessive bile that goes to the brain and often can create hepatic encephalopathy, which is a different kind of brain trauma. And and in fact, he has had mild encephalopathy a couple of times. And so, but none of his doctors ever talked about the impact on the brain. And of course, he has very severe mental health issues, and there's medical trauma and all sorts of other factors. But when you talk about that impulse control and the specific symptoms that you see from brain injury, I can make a direct correlation for our son. So I think it's just worth saying, you know, many times there's kids who go through transplantation, medical traumas that causes them to have a lack of essential things happening with their brain. And I don't think we give it enough education. So I really appreciated this, Kim. Thank you.
Absolutely. And thank you for sharing. That's such it's such an important situation to bring awareness to too, because that's not something we always think of, right? And so I appreciate you sharing that. Something else too that reminded me of is we do have a client in many of our programs who sustained, unfortunately, there was a line drive softball pitch to his heart, and it stopped his heart for, you know, a few minutes. And so because there was no oxygen coming from the heart to the brain, it caused a pretty severe brain injury that's been long lasting. And so even just specific situations like that, we don't always think of, but things like that can definitely cause brain injury too. So I appreciate you sharing.
Dr. Liz?
Yes, hi. This was a great presentation. And because as a pediatrician, when we see a lot of concussions, I mean, we're just based on, we're doing things based on the physical and are they back and returning them back to sports. And I don't think there's a lot of time on what are the possible long-term emotional effects and psychological effects. And I don't think that's encouraged in the sports, you know, as far as the athletes and the trainers and the coaches and all of that. If you could wave like a magic wand, ideally, I think it would be great if whenever someone has a concussion, especially two, to kind of plug them in as a preventive way to talk to someone about what they're going through and if they're having any issues, because that's going to take conversations rather than a 15-minute check-in. So what do you suggest? I mean, are your support groups readily available? How can we get this more as on a preventive track?
Yeah, absolutely. So that's a great question. So our support groups are readily available. Some of them are in person and some are virtual, like I mentioned, many are hybrid. And so we generally have one in every county. I can definitely send a list of those. The best way to connect to any of our services is this phone number on the screen. So if you call that, they can connect you with any of them. But in terms of prevention, we have been trying to outreach to physicians more, to kind of the first responders that might be coming into contact with youth with concussion first, to get the word out there, get the education out there, and kind of encourage that screening. Of course, it's not always easy to gain entry into these places to spread the word, but you know, we're working on kind of increasing that awareness, which I think is really important. That's the first step. And I mean, certain like my first thought when you were saying that with the screening is the state strangulation response teams. So as part of their general assessment that they do with everyone who has had a strangulation is a brain injury assessment, right? And so it doesn't have to be involved. So I'm thinking with youth with concussion, that mental health assessment doesn't necessarily need to be like 20 questions on, but even if it's just a few questions to screen and then take it from there, you know, anything like that could be helpful. So yeah, we're working on the awareness, which I think is the first step. But yeah, in terms of prevention, I think screening is really key.
And that's just to add on, and that's great. And then just something for us and as clinicians also to keep in mind is that, you know, it may not be like they're in extreme depression, but especially when you're an athlete, if you can't get back on the court or back on the field right away, or you're not working at 100%, that's gonna impact how they feel about themselves and you know, just their self-esteem. So that's great to keep in mind.
Absolutely. Yeah. Thank you for saying that as well, because absolutely very important. And sometimes what we hear, like you had said, it's not always necessarily severe depression that they're going into, right? So sometimes it's just, I've heard, actually, I was at a high school fair yesterday and I heard from a couple of the students with concussion that they just didn't feel right since. Like they're like, yeah, I think I'm all right. I think I'm fully healed, but you know, not 100%, but I can't really put my, you know, finger on what is wrong still, you know what I mean? So it might just kind of be vague like that. But still obviously helpful to pursue that and try to address it. Are there any other questions? I see, okay, people in the chat. Thank you for the feedback. Appreciate it. And if anyone else wants to reach out with questions after the fact that you might not want to ask right now, you can reach out to my email too. So that's always an option.
Kim, thank you so much for taking the time. And I have to say, I learned a lot. I didn't realize, here's again, there's resources and not knowing sometimes where to connect some of our young people and families too. So thank you for raising my own awareness. I appreciate it. Thank you for your time. Thank you for allowing us to record this so in case people missed it. And I hope people will reach out to Kim and the organization if there's additional questions. So thank you. That was great.
Absolutely. Thank you so much. I really appreciate you having